Hi, everyone, and welcome to this week's Roundtable with Joey's Legacy and with the Spodcast. I'm your host, and I'm going to be speaking today with one of our attorneys that is affiliated with Joey's Legacy, as well as one of our veterinarians. So, this is time for you guys to ask questions to help you guide you through some of the stuff that you've learned if you're a part of Joey's Legacy. And if you're new to the group, we're here to answer any questions for you. So, before we get started, I want to point out that Scott Fine will not be with us tonight, who is the founder of Joey's Legacy. So it's hard to not have him to the first one. I'm sure it's just as hard for him. He really wants to be here and be active in all of everything that is happening and watching the growth of Joey's Legacy. So, but he's set us up with some really brilliant guys that are going to help us tonight, and we're going to kind of talk about this. So, real quick, I just want to point out, and this is just an observation, this is just my personal experience. This is not a sexist remark, but I love that we have guys that are standing up for these dogs, because a lot of times people think it's just women that feel this way, and so I just love that, and that's just been my experience. I've always worked with female veterinarians, and so it's just kind of awesome that I got you two guys on here, and you guys are just I don't want to say they're the only two, but it's just awesome to have this tonight and been led with all of you guys standing up for these animals, including Scott and Jerry. And so it's just been a different experience for me to see men standing up for these dogs. So, Jeremy, so I want to introduce Jeremy Cohen. He's the one of the veterinarians with Joey's Legacy. So, Jeremy, tell us a little bit about the Boston Dog Lawyer, how you started it, what you're doing, those kind of things.
Sure. Just to clarify, I'm one of the lawyers,
Oh,
not a
right.
veterinarian yet. I've thought about going to vet school too, but uh, we have Dr. Dim. I don't need to go to school. He already did. Uh,
I'm so sorry.
it's all right. So my law firm is Boston Dog Lawyers. We represent pet owners, and we're trying to be a resource to pet owners really around the country. And then if we get calls, which we do from other states, we try to farm them out to lawyers, like-minded lawyers in other states uh, where they are. And one of the great things about Joey's Legacy that taught us is people might think a lot of people call multiple calls a day saying the vet killed my dog or the vet caused injuries to my cat or dog. But what Joey's Legacy, the credibility that Joey's Legacy has is that we may think that, but in order to really know, we get the records reviewed by independent veterinarians who look at the records. They don't know the parties involved, and they try to figure out what went wrong. And even if something went wrong, it doesn't necessarily mean the doctor or the staff did something wrong. But to be able to give pet owners not just the idea that here's what went wrong and you should blame your vet, but also here's what went wrong, but this was no one else's fault. And so I think that's another piece to Joey's Legacy that we're seeing that can bring some peace of mind to pet owners too, because you got to know what happened.
Yeah.
And that's the great thing about the vets that are part of this. They'll let you know if they can.
Yeah. Sometimes we desperately want it to be somebody's fault, and that need for it to be somebody's fault can actually the rest of your life you can sit with it, and sometimes it's not someone's fault. You make such a good point there, and that is why Scott Fine, Joey's Legacy, the founder, brought the two of you groups together, these attorneys and these wonderful veterinarians together, so that we could get to the bottom of it and help people. So um, with us tonight also is veterinarian Dr. Michael Dim. Thank you so much for being here.
Great to be here. Yep, I've really been part of Joey's Legacy since the beginning, and I certainly, get my fair share of cases. Just like Jeremy was saying, it gives us an opportunity to look and see if what went on was just, not fair play, and we need to look further at it, or whether it's something that is just, a difficult end of life situation, and it was no one's fault. And so sometimes we're dealing with the grieving process. And whenever we're dealing with the grieving process, there's always going to be anger, and sometimes, well, not always, but often anger, and obviously deep sadness. And, we really have to be aware of that when we're interacting with the clients. It's very, very important.
Yeah, it's really hard. I had a really great veterinarian friend of mine say that one of the reasons why people want it to be someone else's fault is because it's hard for them to think that it isn't anyone's fault. And so if it's not the veterinarian's fault, then they think it's their fault. And that's
Right.
why they become they can't be my fault, so it has to be someone else's fault. And sometimes there's just no fault at all.
Or there's a breakdown in communication.
Yeah.
That's just like with any relationship between a veterinarian, between a husband and a wife, or between a boss and an employee. Whenever you're dealing with relationships, the key element that happens is communication breakdown. So many of these cases, I'd say most of them, whether they're negligence or not negligence, most of the discord revolves around some sort of communication breakdown. So at least this gives the veterinary community an opportunity to look at that, to see how could they communicate better so to avoid these sort of misunderstandings and sometimes negligence, obviously, when that, in the future.
Right. So really quickly, for any of the listeners that are coming on, or some people that are watching us, Joey's Legacy was started by Scott Fine, who is the founder, as I mentioned, and he had a dachshund named Joey. And it's a tragic, sad story, but Joey was taken to a veterinarian who chose not to run any kind of diagnostics, blood work, and then in doing so decided to give a medication that ultimately resulted in the death of Joey. And Scott decided that something had to be done. So he took the case all the way through and ultimately found that there was nothing that could be done, that the veterinarian would get a slap on the wrist and nothing would change. And he also found that that same veterinarian had multiple cases against him and nothing was done. And that is how Joey's Legacy was formed. And he knew really early on that he needed to have veterinarians review the cases because, lawyers don't understand, right, Jeremy? They don't necessarily know what goes on in a veterinary hospital, so it's really hard to determine. And then once a veterinarian like Dr. Dim reviews the case, it then gets sent to one of the attorneys like Jeremy, and then it goes from there. Correct, Jeremy?
Right. But we need that record review first. Exactly.
Yeah, because a lot of times we are emotionally, like we were saying, it ends up. So Joey's Legacy is just the only organization that I know is that does this, because it's really hard. And you made a really good point early on, Jeremy, about nobody knows anybody. So there, a lot of times you can have veterinarians. If your pet dies in a veterinary hospital, Dr. Dim, you can discuss this or talk about this. If a pet dies in a veterinary hospital and you go to the veterinarian down the street to find out if it's bad, there's a real good chance those two veterinarians know each other or have worked with each other. Correct?
Right. Yeah, usually there's some sort of relationship going on there, absolutely, between most of the local veterinarians.
Yeah,
Yes.
absolutely. And the same thing can happen even with attorneys. So this is why this is one of the really important things. And if I live in a kind of a small, medium-sized town or whatever, and there's probably about 8 to 10 veterinarians just within a couple of miles from each other. And I can't imagine them, because they worry about their business, so they have to be kind of, hush hush. But how would you find a veterinarian outside? You can't just pick up the phone and say, hey, that's why Joey's Legacy works, because you can't just pick up the phone and call a veterinarian and say, will you review this case for me?
Right.
And
So
oftentimes someone will call and say, the vet I went to, the secondary vet, or the vet I went to try to repair what went wrong, said it was the first vet's fault. And they did this wrong and this wrong. You don't need to get the records reviewed. And I said, well, did that vet put it in writing? Well, they told me, yeah, but they're not going to put it in writing. And so,
No.
but it makes sense. I mean, there's karma concerns and there's reputational concerns. So that's why we do have to go out of state to get the vet experts, but it's still valid and credible, and
yeah.
and we can use it.
So the other way too, trying not to talk poorly and also trying to rat the guy out because maybe he's got more business than you do. So there's so many reasons why. Now we hope that doesn't happen, but you can see it happen all the time where someone could absolutely tell a client, oh yeah, it's totally his fault. He did this, he did that, and he or she didn't do any of those things. So So it's just been such a blessing to watch Joey's legacy continue to grow so that we can stop. And so the main goal here is to help prevent veterinary malpractice. So I ask this a lot of our veterinarians that come on. So Dr. Dim, can you tell us a little, I know I've asked you this before, but have you ever seen veterinary malpractice in any of the places that you've worked?
Oh, absolutely. Working in multi-vet hospitals, unfortunately, the ego often gets in the way. It's which, we all have an ego, but in some cases, when it comes to just outdoing your partner, or outdoing your colleague, or just, doing it for some sort of self purpose, whenever that happens, we're going to end up with with perhaps animal care suffering. And so many times when I've been in these multi-doctor practices, it's about outdoing the colleague than it is over what's best in animal care. So yes, I've seen it, and I've wanted to say certain things sometimes, and I held myself back. It's difficult, especially when you're in an employee sort of relationship, in that sort of relationship.
Right.
And so it's something that does go on. It goes on every day, just like when we talked about with vaccine reactions, right? Those are things that go on every day across the country. People say, oh, they're rare. But in our animals, I mean, I'm one small practice, and a lot of times, I get calls just for, let's say, vaccine damaged animals. And so, whenever people think that this is just a rare instance, we're talking now negligence or malpractice, it really isn't. It goes on quite frequently. But it's important to understand that when we get these cases, as Jeremy said, we want to make sure we do an objective record review, and not out to get the veterinarian or to, obviously, we have a lot of empathy for the clients no matter what, and a lot of compassion, but we have to be fair in our assessments. And sometimes, I'd say in about a third of the cases, there isn't a case. It's there's just a unfortunate outcome, or clinical judgment. That's another term I often use with some of the clients who come to me. Is I'll say, what you're describing is not negligence, or the veterinarian is not guilty of malpractice, but is some clinical judgment where he or she made a decision that, ended up not having good results. That's not equivalent to the veterinarian doing something wrong.
So you make a really good point, and I think it's one of the reasons that we're not seeing this big, huge explosion with Joey's legacy as I would like to see. I think people think veterinary malpractice means that the pet dies right there in the office, or something really obvious happens. But veterinary malpractice, like you're saying, happens every day, and people aren't aware of it. And it gets, it's not like your dog can come tell you what happened back there and whether that was veterinary malpractice. So it can get hidden quite easily, is what you're saying, right?
That's right.
Right. What did you say?
No, go ahead.
It happens all the time. I've witnessed it myself in all of the vet clinics that I've worked at, and some were obvious. I've shared this on the show before. I worked in a vet hospital where an animal got the wrong leg amputated, and it was absolutely veterinary malpractice because the vet never even looked at the x-rays. So those are obvious. And then some of the other ones, over vaccinations, giving a vaccine that they shouldn't be giving, or how about when the pet parent said, I don't want that vaccine, and then they end up giving it anyway. You may not even know.
That happens all too much, unfortunately. Yes.
So Jeremy, can you explain what veterinary malpractice is? We hear these two terms used a lot, negligence and veterinary malpractice. So can you just really quickly explain what those are?
Sure. And I'm just blown away by you saying that this isn't taking off Joey's legacy in terms of pet owners. My phone is constantly ringing with people every day, the saddest stories, and something went awry, and this, they usually think it's the vet. I mean, last week we got hamsters at the vet, ferrets, lizards, along with the dogs, cats, and horses. So this is the belief that is happening, at least, is prevalent. But anyway, I'm just surprised this group, this Joey's Legacy, it should encompass every pet owner who's out there, because that's what my practice has shown me, that I didn't even know this was a thing before I opened my practice 6 years ago. I didn't have any space in my practice for vet malpractice cases. And now that's half the calls. So I've given this example on this show before, and it kind of makes it easier, especially since we just got 2 cases where the dog went in for a spay and a neuter. And then a couple of years later, like, it's suffering, is either limping or has some infections, and vets subsequent to that can't figure out what's happened. And it turns out in each of these 2 cases, a sponge was left in. And for 2 or 3 years, trying to figure out what the problem is, and then that material gets infected. And so a veterinarian who is performing a spay or a neuter and leaves a sponge in, or some type of what I would call a sponge, I'm sure Dr. Dim has a more technical word for it, that's malpractice. In my world, and I don't know why this doesn't happen, I've been told it doesn't happen by vet techs, but if 6 sponges went in, then 6 sponges go out. But I've been told that they actually don't, in some instances, count. And obviously, if they counted, these places wouldn't be leaving them in. So that's malpractice, where there's a certain expectation, a minimum standard that any vet in that position is going to remove all the sponges. An example of negligence is more the cases that I have where the animal got injured. So one case where the vet tech took control of the pet and was walking the pet into the building because it's COVID, and the dog got loose and ran into the highway and got run over. So that's negligence. There's no medical malpractice where you failed to do or not do something, given your education experience. Here, that's just your dog or cat got killed or hurt at the vet, but it's the vet's fault, but it's not to the level of malpractice. So it's a completely different type of action. But either way, and I think pet owners don't know this. I know the urgency when they call, and sometimes I'll get calls right from the hospital now. You have, in most states, 3 years. In some states, it's even more. Maybe in some states, it's 2 years. But you've got time. You don't have to file a claim right away. Sometimes you should be focusing on fixing your pet if it's still possible, and grieving, and then we'll be here. The vets and the lawyers will be here, but it doesn't have to be done within the first 24 hours. Or
that I think is a great point, because we all hear about statute of limitations, and nobody really knows what that means, or if it would apply to an animal. How many years with the sponge that got left in?
So it's different by state. So I'm hesitant to say for us, it's 3 years from the date of the negligent act or the wrongful act, or when you knew or should have known about it. So in that case, no one would have known about the sponge until they actually saw it. So that added an extra couple of years onto the statute.
Wow, I'm so interested in this case. I don't know how much you can talk about it, but was the animal sick a lot and they just couldn't figure out what was wrong?
Yeah, and I'll tell you the worst part of this, it's so clear. I mean, doctor did it. It's so clear. Dog suffers. Owner incurs about $20,000 in medical bills. Ultimately, because of an infection, a leg had to be amputated. And we're still fighting this. And this is the problem. That should have been, we proved it. Here you go. Now we're in litigation. We're 8 or 10 months in. And that's because for decades, they've been allowed to just say, well, you better prove it. This idea that things go away easily, they just don't. That's the clearest case we have. And that's still going to take a year or 2 to resolve. And that's what's not right about this whole thing. They should be saying, I mean, we know these aren't big dollar cases, but at least give her the money back that she spent to have to figure out what went wrong. Plus, you diminish the value of the dog's life the quality of the dog's life and the owner's life. Think of all those times she can't walk with the dog. It's summertime. She can't go out with the dog. And the insurer and their lawyers are just making us battle and battle and battle. And so now we're not going to go away just to have her be reimbursed. Now it's a war, and it doesn't have to get there. But before we can change that mentality, we still have to show pet owners they have rights here. And until we can get enough on board to support us, we're not that strong.
Wow, that is crazy. And if that veterinarian would just say, "Oh, I did that," like, it's obvious, it would be so much easier to move forward, pay the damages, and move on, right?
Right. And I guess my point too is it's out of the vet's hands because the insurer is involved, and the insurance company does not care about you and your practice. They just don't. They don't care if you retain a client or a patient. And I'm working with a group that's trying to develop another way to resolve cases without. It would be groundbreaking, but without having to go to litigation. Just trying to bring the parties together. But I've talked about this before. But insurance companies tell vets they shouldn't be speaking to anybody, and that's why they end up calling us because they don't know what happened.
Oh my gosh, we have a question coming across that I want to ask from Deborah, and she says she's talking about standard of care. So we should probably talk a little bit about that. But her question is, what can be done to get standard of care put in place for vets, as in the medical profession of world for doctors and nurses? But if you could just explain what standard of care is first, and then maybe answer her question so other people know what that means.
I think since Dr. Dim has to live through the standard of care, you take
You
it.
do have to. That would probably be best for you, Dr. Dim, to answer what that means.
Well, standard of care in my mind, well, first of all, it can still be very objective because the standard of care still has to be interpreted by someone in a legal setting or in a state board type of setting. But standard of care to me means basically just expected level of both competency and practice that an animal, should actually receive, and most veterinarians across different venues would treat that animal in a certain way. So it's certain, I don't know, I want to use the word standards again. I'm just trying to define it. And maybe you could help me out here, Jeremy. It's how you should be practicing according to what your colleagues and what should be expected of you as an experienced, competent veterinarian. And if you're practicing below that, then that rolls into negligence, obviously. Go ahead, Jeremy. I'm not great with the words.
No, that covered it. And
Yeah.
what the person who's asking the question is saying, here's the standard for veterinarians, and here's the standard for human doctors. So human doctors, we're so much more protected, humans are, when we go to our medical doctor. For veterinarians, the standard is this. It's set by the people around you who work in the region, essentially. And it's, would 50% of the vets in your area have done the same thing? And if 50% of the vets would have done the same thing, for instance, maybe it's they gave a diagnosis of kidney failure, but it also showed that it could have been, let's just say, Cushing's disease or something, that if the vet went the right way, and it was like Dr. Dim said, that that clinical judgment, if half the vets in the area would have done the same thing, the vet is okay and the pet owner is not protected. Versus in the medical community, you have to do what 9 out of 10 doctors would have done in that situation. You're held to a much higher standard. And I went to the vet the other day. I was there for 25 minutes and it cost $750. $750. Now I got some meds with that for my dog. So if you want to charge that money, then you better increase the standard of care. We're paying top dollar for this, and I know insurance will cover that, but $750 for 40 minutes. And I know they ran tests and stuff, but it's it's not right that the standard of care is kept so low. It's actually should be an insult to veterinarians. But the one reason I do understand it, and this is what I tell people, it is very hard, I think, to be a veterinarian. Your patient isn't talking to you, and when you start to look at symptoms, it's the same symptoms: vomiting, diarrhea, that fit across so many different ailments that I think it is pretty tough to be a veterinarian. But so I understand why the standard would be a little bit different. I do have that understanding and reasonableness, but hopefully that explains the standard of care a little bit better.
Well, yeah, you should also leave options for the client as well. So a standard of care, so with Scott's dog, for example, from what I remember, the details of it, I believe that they gave a drug that's kidney toxic,
Right.
and an antibiotic. And so that antibiotic's used across the country by vets just willy-nilly. I mean, it's just used every day on cats, on dogs. The antibiotic's called Convenia. And, an appropriate standard of care would be, in every one of these cases, would be to check liver, kidney values, blood work, if a drug is potentially kidney toxic. But unfortunately, most veterinarians don't do that. So in this particular case, I mean, Scott actually, did his own research and was like, wow, my animal should have been given these tests before he was given the drug. And so, that's an example where, so many vets get away with that. I mean, so many clients get away with, so many vets just get away with, being able to practice that way. And that's because, in human medicine, blood work and workups and sonograms and MRIs are all routine. They're not all routine in veterinary practice. In fact, when Jeremy brought up about vomiting and diarrhea, 95% of the time, we don't even make a diagnosis. We're just treating the symptoms of the patient. And the patient gets better 80% of the time. If it doesn't, and it's in that 20% of the time or 10% of the time, even less, then we have to go further. And so, but the point is, right in the beginning, though, if you get like a seizuring animal, if you get an animal with vomiting and diarrhea, you want to offer the whole workup to the client, because that client should have the rights to make decisions on whether they want a full diagnostic workup or they want symptomatic care. I'm just interested, Jeremy, with your particular animal, was it an acute illness that ended up,
Well, when I was telling the story, I combined two cases. So,
okay.
It was this constant limping by the dog, because it was a young dog, because she had been spayed just a couple years before. So it was this constant limping, and people just couldn't figure out why. But Dr. Dim, you once explained something to me, and can you explain the acid bile test? Because in my mind, this is a simple, inexpensive test that could prevent some bad things from happening at the vet.
You're talking about a bile acid test. Okay. So a bile acid test is what we call a liver function test. So when we have animals that are on medications that are processed by the liver, and they're on those medications long term, it's actually not appropriate just to do a CBC chemistry to see what the general liver enzymes are. You want to do what's called a liver function test to make sure that the body's liver is functioning adequately, and that's best done by a bile acids test. So, for example, a dog who's on Rimadyl, it's a common drug. Often that drug can be toxic to the liver and kidneys. But if you don't run a periodic bile acids test, or if an animal's on chronic phenobarbital for seizures, if you don't run a bile acids test, to me, that's below the standard of care for an animal that is on these drugs for months after months, year after year. And the vets, the ones that do lab work, a lot of them are just doing the basic CBC chemistries. But the bile acid test is the main liver function test they should be doing.
So this is for pet owners whose pets are on long-term meds. And is it an expense? I thought you explained to me before, it's not an expensive.
Not an expensive test at all. In fact, you can get by running one sample by just feeding the animal and doing a blood sample 2 hours after it eats. And that's usually adequate to pick up liver disease or liver dysfunction in most cases. So when I bring that up, it's, I don't know how many vet boards or how many legal people would actually, because of the different like you said, there's a different standard. The vets are here and the human profession's up there. And so it really does come down to judgment. But in my view, if you want to dot your I's and cross your T's, the only liver function test that we have in veterinary medicine is a bile acid test. Some people say an ammonia test or an ammonia tolerance test is also one that is adequate for liver. But in general practice, the bile acid test is the gold standard for liver function.
There are certain things that veterinarians absolutely have to do. Like, we know you have to keep records, that, or you can get in a lot of trouble for that if you're not keeping proper records. So when Deborah asked the question, is there something that can be done to get a more specific standard of care? Do you think that we can get to that? Since we do have some things, like you're saying the bile acid test is your standard, but how do we get it to be the standard? Is that possible, or is it just?
I don't think it's possible. I think it's almost like someone, if you, the technical definition is yes, if you're going to like really be dot your I's and cross your T's, that's what it is. But because vet boards and legal, medical malpractice agents, they, if a veterinarian runs blood work, a lot of times they're going to say that's adequate. Now, granted, a lot of times the liver enzymes will be elevated on the routine chem screen, and that way you don't have to necessarily do the bile acids test, but the ALT, the liver enzymes don't have to be. So, there are cases where these animals are on chronic phenobarbital or chronic Rimadyl, and the liver enzymes are normal. Then all of a sudden the dog has cirrhosis, and that's because there's a smoldering inflammation going on that doesn't show up in a routine chemistry. Now, that's not as common as finding it on a routine chemistry, but to make it a gold standard, though, Carrie, it's going to be difficult because we're not dealing with like academia. Let's put it that way. It should really have academic standards. When you're dealing with life and death and making diagnoses, it really has to go under. If you screw up, it's really, it's a life and death sort of thing. And
Well,
they shouldn't allow these general tests or these exemptions to
right.
be considered adequate standards of care, in my opinion.
Well, yeah, going back to what Jeremy said about the gauze, it's real simple. 6 went in, 6 need to come out, and somebody needs to count them.
Right.
One, that should be a standard of care. It should be, and it's not. And in Joey's case, running a blood test to give a drug that says right on the label that you cannot give to a dog with kidney failure should be an automatic thing. If the drug is something, it's not, we're not giving Pepto-Bismol here.
Right. Right.
When it's something that has side effects like that, it's just heartbreaking to think that we can't get the standard of care written out in order to protect. Although, back to Jeremy's comment about the differences between medical malpractice, human and veterinary malpractice, it does make sense that it would be harder when we're talking about animals that can't speak. And so there has to be some judgment there. I do understand that, but I guess to answer her question, it doesn't sound like there's going to be anything. Jeremy, do you think there's something that can be done with the vet boards to get them to come up with a standard of care legally?
No. Yeah, we have a vet board. The president of the board is also a defendant in a case. And we asked some simple questions. Hey, when did you become president? I don't remember. Well, how'd you get elected president of the licensing board? I forget. How many people voted for you? Did you have any competition? She wouldn't even answer those questions. So no, I haven't heard from any state yet who has said our licensing board is outstanding. They do a great job. They keep the practice nice and professional, and they admonish bad behavior. I just haven't heard that from anybody yet. So the idea that these boards, no, they should be, those are, if you could change the boards, then you could change so much more about the bad behavior.
How are the boards formed? Are they elected in? I don't even know that.
In our state, they're appointed by. So you have they fall under the governor's council, and they're just appointees, and you usually have to have like a lay person, a veterinarian, maybe a tech. Like they have certain spots they have to fill, but those aren't open to the public. And even I watched a hearing and they shut the hearings down too. So those aren't even open to the public. I did happen to see this election, so I knew that this person got elected president of the board. But what happens when we have a complaint about her to the board? How is anybody on that board going to find against her?
Never.
And there's only 4 or 5 people on the board. So there's just things that aren't right, but we can only, we're attacking it at the vet level, but really if it was attacked at a higher level, things would be much better, I think, for everybody.
The other thing, Carrie, let me just say about standard of care that we touched on earlier is that the idea of specialties, and this is also a little bit of a problem with Joey's legacy. Sometimes let me just divert for a second. I'll get cases presented to me that are surgical nuances that really need a surgeon or surgical expert. Now, as far as I know, Scott doesn't have a board certified surgeon on the vet group. That would be the ideal, where you had a specialist in each category that really, rather than a general practitioner, we're looking at it in a general sense. Right. A lot of times we'll get questioned, well, who are you? Are you a general? What's your experience? And so you have to keep in mind that the standard of care with veterinary practice, even though it's come a long way and there are specialists, there are cardiologists, there are neurologists, there are, oncologists, obviously, plenty of those. It still doesn't come at the same level that you see in human medicine, where if you have a little heart murmur, not a little heart murmur, to cancel that, if you have a heart murmur, because that's significant, and you don't get referred to a cardiologist, your general practitioner is guilty of malpractice. And not every client whose animal gets listened to as a murmur is going to a cardiologist. Right. So I'm just giving you an example that there are different, it's difficult to come up with like a gold ideal standard, because there's differences. You really have to go more along the human side of things. And our profession just isn't there yet.
Yeah.
It may never be there, may never get there until animals are more legitimized as, what we're working towards is not property, which right. brings them back to that.
It's always going to come back to that, is that they're seen as property, and that's why we're here.
But let's look at some of the things that we accept. Again, I went to the vet the other day. So it's only recently, up here at least, they won't even let you in the vet facility. So every place, even when COVID had improved, every place is open. Doctor's offices, there's plenty of people in the waiting room. And at least up here, the veterinarians don't let people in still. Yeah. And I get calls from pet owners saying, can you change this? And I can't change it, but I can say that lack of transparency. We know we could be allowed in there. We don't have to worry about COVID in the veterinary facility, but we know why they're doing it, so they don't have to talk to us. It's that simple. They have found an excuse that they're hiding behind because of COVID, that no, we can't have pet owners come in. That's been going on for almost a year and a half. There's no need for it. And this is why we don't trust the veterinary profession, at least up here. How can you not let us in and still blame COVID? It makes no sense. It's just, that's the example of how is this being allowed to happen? Right. But who do you complain to?
It's still happening here too. Dr. Dim, there's not anything coming down from the AVMA that would, or any.
Not that I've heard of, yeah.
I just want to make sure, like, no one's saying, hey, veterinarians, we don't want you letting people back in. These are personal decisions by veterinarians not to let you in the office.
Correct? Right, yeah. Exactly. I don't know. I don't have an answer. Although I'm not, to be fair, I'm not in general practice on a regular basis these days anymore. So as far as I've heard, no, there aren't any. Yeah. Aren't any edicts that have come down. No.
I've asked a couple of veterinarians who have said no, it's their personal decision to do that, and it's still continuing to happen. And dogs are still getting loose on, running the streets and getting misdiagnosed because there's nope. Now you have an animal that doesn't speak, and now you have the owner in the car. Right. It's just that is really starting to get on my last nerve because I just don't understand it. But so we have another question that came through from Liz, and she says, I took my dog to 2 vets, one being a vet clinic, and they misdiagnosed and didn't do the scope I asked for. They said it wasn't necessary. Last month, I took him to an internal medicine vet specialist who did the scope and found he has a collapsed trachea. And then it says, sorry, I have to go on to another. Is there any recourse? For months, he has been coughing daily and excessively and not feeling good at all until now. Now he takes 2 meds and will be started on an inhalant. She also says that the specialist cost her $1,500 plus for the medicine and inhalant that I could have avoided had the vet done their job. That's going to be for you, I'm sure.
Well, first of all, I mean, that's a great example of where a client, if given all the options, would have chosen the more aggressive option first. In other words, the non-symptomatic approach. In other words, she wanted a diagnosis. That's always the gold standard in medicine, whether it's human or veterinary medicine, is you want to make a diagnosis. The vast majority of times in veterinary medicine, we say what we think it is. We say it's most probably, but most of the clients don't want to, let's say for a coughing dog, that if I touch the windpipe and it goes into a goose-horn cough, that we know 90%, 95% of those animals have a collapsing trachea. And we could treat those symptomatically, and usually the medications are give enough relief for everybody satisfied. But in this case, you had a client who didn't want to hear what she thought it was likely. She wanted a definitive diagnosis. And so that's why we as veterinarians always have to give all of the options. And, I have to be honest, I was sometimes guilty of that also. I mean, if I had a dog, for example, or a cat coming in with vomiting and diarrhea, and it was going on for a few days, if this was a human, right, you'd be at a gastroenterologist being scoped. But in veterinary practice, we're just, we don't typically do that. We typically will treat them symptomatically. And then the next step would be an ultrasound, which is not even done in GI medicine and human medicine these days. Then ultrasound is part of a workup. And then after that, then the scope is later on. And so but I think we can avoid the trap as veterinarians by just trying to remember, okay, this animal's vomiting and diarrhea. The odds are this is what the problem is. It's going to go away in 24 to 48 hours with symptomatic treatment. But if you want a more definitive answer, we can work up to this, and this, and this. And most clients will not choose to go the $2,000 workup when they could get, a few dollars worth of medications. So I don't know if that's helping explain,
No, it does, because I think that, I've seen that where veterinarians, you're in such a hard spot as a veterinarian. There's usually not insurance that's paying for these. So it's out of pocket
Right.
for pet owners, and pet owners complain about the price. So you get stuck in this place where you want to help the animal, and then you start saying it could cost this much, and then, you just don't know. It's such a bad place. So you're right when you say you just have to offer everything to them, and then they decide from there what they want to do. But Jeremy, in this case, the veterinarian deciding not to do the scope and then finding out later that the scope is what got to the diagnosis, she's saying that she asked for it. But would this be considered any kind of, I don't know how much time passed before, because that's collapsing trachea, Dr. Dim, is, if I'm right, it's progressive. So maybe, I don't know how much time went by. Liz, if you can maybe let us know how much time had gone by in between when they didn't scope and when you finally got the scope. But would this be any kind of practice on the veterinarian's part?
Here's the problem. In the veterinarian's notes, it is not going to say owner asked for scope. So now, whether she asked for it or not, and we'll take her word that she did, she could easily find out on the internet that you should have asked for a scope too. So now, because it's not in the notes, now the proof that she asked, that really harms the case. I see a lot of records where it's well noted when someone turns down the more expensive or more aggressive diagnostic testing. I have had a lot of calls where people saying the vet's not listening to me. I told them exactly what I thought should have been done. But that might go back to what Dr. Dim had said about ego, and saying, hey, you should be looking at this instead of that. And they're probably, did you go to veterinary school? So, but the thing is, where these animals can't talk and the owners know them so well, you need to put a little bit more into what the owners are telling you. And certainly, to get back on this point, it's really hard to tell somebody by text or by the phone from your car exactly where on your dog or cat you want the vet to pay attention to a lump or something like that.
Oh no, you're
And the
so
problem in a case with this, like this, Carrie, is that a collapsing trachea is a good example. It's very narrow, you know that. There's 2 or 3 medications that are used, cough suppressants, anti-inflammatories, bronchodilators to dilate the airways, and then that's it. And then the next step is a surgery that is not always successful, to widen the windpipe and to put certain stents in there. And so in this case, like I said, the veterinarian should have wrote owner asked for, for scope. I can't think of in my 30 years of practice how many owners have come in and asked me for a scope when their dog's coughing and they just want the cough to go away, and I put my fingers on the windpipe and it goes into a cough spasm, and it's a Pomeranian or a Maltese and it doesn't have a heart murmur and it's a young adult, then I know that's most likely a collapsing trachea.
right.
Again, I use the term most likely. Does that mean it's a definitive diagnosis? Of course not. The only way you can do a definitive diagnosis is by doing a scope, or in other diseases, getting a biopsy. And that goes back to what's an expected standard. So if that client, I forget, what is her name? I don't want to just refer to that one. Liz. If she had just come in and not said anything, and eventually the dog ended up getting scoped, that veterinarian's not guilty of any sort of negligence, because he or she, was just following an expected standard, which is when you get a little toy breed dog that has that signalment, as I was calling it, that classic history, that's
Right.
considered an acceptable standard of care to treat the symptoms and say your animal likely has a collapsing trachea, or probably.
Right. Well, that seizures is another example, right? Because seizures could be
Right.
so many things, and if your pet comes in having a seizure one time, so a lot of vets will say, well, let's see what happens, let's see
Right.
what medications are they on, maybe we can remove that, before they go straight to doing ultrasounds and MRIs and checking brain scans and that kind of thing, because
Right.
it can be costly. But I don't think that would be negligent on the veterinarians, but it should be, these are all the things I can do, like you had already mentioned. But to put it off on a pet owner, and I hate to do that because I know no one likes to hear it, but we also have to be able to say, look, what else tests can be done? We have to, and I know Liz says she did do that, but a lot of times pet owners won't do that. And so it leaves the veterinarian in that guessing game. Do they want to know that I could put their dog under anesthesia and do that? Can they afford it? Can they do this? So we have to communicate. I mean, there just has to be some communication on both ends. And so I know I always tell my clients, I'm not a veterinarian, but I have lots of clients. If you have all the money in the world and this is what you want to do, this is what I would recommend. But if not, then we can do these things. So it's just,
Right.
it's just, I don't know, it's difficult. But that's why she said she's typing in right now, she specifically asked for a scope. So that's so interesting to me. Why wouldn't a veterinarian, if a client is, I'm thinking, if I was a veterinarian and a client standing in front of me saying, do the scope, is there a reason why a veterinarian would not do the scope? Is it super harmful?
Well, first of all, most veterinarians don't have the skills to do a scope. They'd have to refer them to a specialist to do it.
Okay.
And I'm going to just to be on the, just an objective side here. If this animal was referred directly to a specialist, I didn't get the rest of the history of how long the dog was coughing, that kind of thing.
Right.
She
Yeah,
asked
we
for
don't
the
know
scope.
that.
So, but basically, if an animal comes in a first-time presentation, I can't think of any specialists I know that are going to automatically do a scope, given the history that I described in the certain breeds or certain physical exam findings that, highly probably lead to a diagnosis of a collapsing trachea. And knowing that the surgery is very is very risky and not always successful, I don't think rushing to a scope necessarily would be in that animal's best interest. There's also complications of a scope. When you're putting an animal under anesthesia, you're at risk for aspiration and aspiration pneumonia. You're at risk for traumatizing the trachea. I mean, these animals already have narrow trachea. So it's up to us as veterinarians when a client comes in and asks for a scope, let's say on a first time presentation of a cough, is to really explain, okay, that's wonderful that we really appreciate that you want to be as thorough as you do in this case, but first time Fluffy's coughing, it's the scope procedure is risky. It's not going to change the medications we prescribe. And so in a case like this, it's up to the veterinarian to explain that to the client. But I think if this animal went to a specialist and was the first time coughing, the specialist would not have done a scope right away. No way.
Yeah. So Judy asks this question, and I love this, but a little thing she says is, most all pet owners whose pets have been harmed or killed by flea and tick products are told by their veterinarians that the product was not the cause of the dog's death or seizures or other adverse event. Typically, the veterinarian runs a bunch of diagnostics and then says they didn't find anything, and here's the bill. When the healthy pet suffered the adverse event shortly after use of the product, what should people do when the veterinarian denies any cause when it obviously was the product? And is the class action suit their only option?
Well, they got to bypass the veterinarian and go to the drug manufacturer. And usually these companies have departments or sections that deal with these specific circumstances. And so I'll let Jeremy, tell more about it, but typically that's what they would do. And then if there was a negligence action there against the product, or not negligence action against the product, but if there was a problem where an animal suffered or passed away as a result of using the product, usually these companies will negotiate with the client, or that's where they want to focus their attention on in terms of damages, right, Jeremy? I'm not sure.
Yeah, I direct everybody on those types of cases, go right to the manufacturer. They have a budget for this. I mean, they're not going to offer you $10,000, but they know this stuff happens, and it's not the vet's fault. It's hard to pin it on the vet if the vet just had told you what flea and tick medicine to use. But you may not get as much as you want, but you're going to get money quicker. And they won't stand in your way. These manufacturers, they're pretty good about paying something, because they've heard this before. Oh, there's another one of those. They're not going to tell you that, but the woman put it on their pet and all pet's hair fell out or something like that, or there were burns. So they have a mechanism for that, the manufacturers.
And it's just like, these are products, guys, that, nobody would ever use them, if they, if they read the fine print, and so, a lot of dogs use these products and they're okay. I mean, they're not, I mean, I don't, as a holistic vet, I don't think they're okay, but in general, though, these products are used across the country and people use them from the time the animals are young till the time that they're middle age or older, and they don't have problems with it. So that's why the veterinarian who treats them, to be fair to them, who's in conventional private practice, most of the time they're not seeing any problems in most of the animals in their minds. And so that's why you really have to go to the drug company, always.
So I wonder a little bit, Jeremy, about it being some fault and I am one to stick up for veterinarians more than the opposite. But when the FDA is reporting it, when the label says it, and the pet has the adverse reaction after the medication, and a veterinarian says it's not the cause, isn't there some fault there with the veterinarian to at least have said, we should stop that medication, instead of almost, I've seen it where they're like, oh no, it has no effect on mammals. I've had a veterinarian say that to me.
Well, if this woman, Judy, I think was her name, was to put this in suit, suddenly you'd see the manufacturer blaming the vet. Then the manufacturer would say, the vet should have told you all these things could happen. Show us in the notes where the vet gave you all the side effects, or did the vet give you the data card, the insert? And suddenly the manufacturer starts depending on the vet for actually prescribing it without giving the information to the pet owner. And it's a nuance in the law that protects the drug manufacturers, saying it's up to the veterinarians to make sure they've given all the disclosures. And so it comes down to, did she get all the disclosures? Was she told, here's some of the side effects? Was she handed the insert that came from the drug manufacturer? Because the drug manufacturer, I believe they don't give you 200 inserts for each time you're going to prescribe that medicine. They give you a couple and you're going to make copies, and it just doesn't happen. And that information never makes it to the pet owner's hands. And so that's how they then flip it onto the vet.
Well, just a little side note, I only recommend veterinarians that don't sell that stuff. So
Yeah.
that's my thing. If you're selling it, I can't even, it's just so toxic, and I've seen so many cases of it. So that's something that I just tell people. I lost my dog to flea and tick medication back when I was a vet tech. So I just can't. And it was before that stuff had been on the market. I think it started coming on the market. Advantage and Frontline were one of the first ones that came on the market back in the I want to say late 80s.
Right.
And then so nobody knew when my dog was having these seizures, but now we do. I mean, when the FDA is starting to say, okay, I think that we do know, and I think veterinarians have a responsibility to tell pet owners that it can cause these things, and that there are alternatives, which they don't do, because this is easy, and they don't talk about the alternatives, and there are tons of alternatives that work. And so I unfortunately, probably emotionally and through my research, will always think a veterinarian has responsibility to know what that label says, and
Yeah,
to pass that on.
they're poisons. They're poisons. I mean,
And
they are
pass that,
pesticides.
yeah,
Yeah.
and you can't just give it to every dog that walks in there and get away with it. It's not fair.
Right. I
Let the
agree.
pet owner make that decision once they're fully informed, which is another whole thing we could get into, right, with vaccinations, is informed consent, because we don't have that. We just give out drugs, and we give out vaccines, and we give out all of this stuff without informing the client of the side effects and the risks, like Convenia. If that would have been an informed consent before Joey would have gotten that shot, none of us would probably be here. So it's unfortunate, but we're coming up on our hour, or we may have passed our hour. So I don't want to keep you guys too late. You guys are on the East Coast and probably super tired. So, but I just want to thank you guys both for being here and just continuing to be a part of Joey's legacy. It's been so great getting to know you guys both, and just having such a powerhouse, continuing watching Joey's legacy grow. But without that documentary, we need it, because we need more, and just so many thousands of more people behind this and understanding, so we can get those laws changed. And just really quick, Jeremy, the laws right now are that our pets are considered property, correct?
Yes, but these are state by state. Yes, but you're starting to see cracks in it. On the criminal side, where they're starting to hold people more accountable for just basic neglect, and in family law, where judges in some states are starting to be told they can look at what's in the best interests of all involved, or the best interests of the pet. So slowly, we're seeing some changes.
Okay, so I know you touched on it a little bit about, for example, when I think it was Liz who asked about the cough, her dog coughing, and she asked about the scope. She now has to prove that she asked for the scope. So what are we going to do to protect ourselves from finding ourselves in these situations? Do we go in with tape recorders? What are we going to do?
I can't advise that, because in many states it's illegal if the other person doesn't know you're recording it. And people certainly have handed me recordings, and I don't take them. Put stuff in writing. Yeah, email the doctor, put it in writing. Like for Liz, I'm thinking we have to go to her search history on the internet to see when she looked up or found out about a scope, and see if that predates. I'm just trying to think of ways to prove that she actually said it. But again, just because she would have said it, as Dr. Dim said, it doesn't sound like it was the appropriate thing to do at these early visits anyway. Or that, again, maybe it looks like it was a thing to do, but if half the vets in the area wouldn't have done it because it wasn't really the right next step. So that's where you want to blame somebody, but sometimes it's just not malpractice. It doesn't rise to that level.
Right. So we know we get the records. We know we need to, what else can we do to try to help prevent veterinary malpractice? Or what are we going to do to get the laws changed?
Well, you got to step up and fight these and be willing to fight them, even though you're not going to get a lot of money for it. Because what you are getting is accountability. And the great thing about veterinary insurance is it's professional insurance. So when there's settlements or payouts, the veterinarian has to be consulted. And so they know, and they have to answer for the fact that a claim came in against them. And then the other thing is just make credible claims. That's why you can't just throw everything out there and say, oh, vet made a mistake, vet made a mistake. You have to make sure you've got the right case so that people will take these serious in court and at the even in the veterinary practice. Too many people, it's just too easy to complain and to go on social media without having the facts.
Right.
So get the records reviewed like Joey's Legacy does for pet owners.
Yeah. I know that people can reach you through Joey's Legacy, but how else can they reach you? What's the best way if they just want to go outside of Joey's Legacy and contact you?
Thank you. They can email me, jcohen@bostondoglawyers.com. They can go to our Facebook page, Boston Dog Lawyers, or they can call the dog line, which is 844-DOG-ATTORNEY, 844-DOG-ATTY.
Now, I know that you have to practice in your state, but can you give advice to people in other states if they just wanted to do a consultation with you?
I can give guidance as to what the steps would be, and here's how to go about finding somebody, or I might know somebody in that area. So yeah, and I do address those out-of-state calls. Those are important.
Okay, good. I just want to make sure because we have listeners from all over. So, Dr. Dim, what advice can you give, being a veterinarian and having clients come in and talk to you? What's the best way to help prevent veterinary malpractice from a pet owner's stance? What can they do?
Just stand up for their own, just make sure that they're their animal's advocate, that you stand up for your animal and you try not to let them take them into other rooms. And you say, if you take them in the back, like what's going on during COVID, no treatments, no vaccines, no medications without my permission. You always have to be your animal's advocate and stand up for your animal, because again, we have to be the voice for the voiceless. And, that's the best way to put it.
Yeah. Well, you guys have been awesome. And I know Dr. Dim, you do consultations and also you're in Florida. So
Right.
how do people get a hold of you?
Well, for my holistic veterinary practice, which I use other alternatives to preventing acute disease other than vaccines and pesticides and dewormings, and also other than using strong drugs for treating chronic disease, I have a separate holistic practice, and they can go to my website, which is drdim.com. That's doctordym.com, all one word, and that has my email contact information and my office phone number.
And if they're not anywhere near your office, you can do a lot with just looking at their records and doing a lot. I know, Dr.
I treat chronic disease over, by telemedicine. So I've been doing that for years. Yes.
Dr. Dim and I, it hasn't aired yet, but we just did a podcast together. And one of the things we talked about is how sometimes over a Zoom, sometimes you can get a better feel because you don't have all those emotions that are coming in from, maybe we had mentioned someone coming from traffic and they're upset and they bring all that energy with them. And sometimes if you're just calm through Zoom. So sometimes people are afraid to use a veterinarian through Zoom, but in some cases it can be really good. And I'm giving you a personal recommendation for Dr. Dim. So if that means anything, I would highly encourage our listeners to contact Dr. Dim. And he didn't pay me to say that.
Thank you. Thank you, Carrie. I appreciate it.
Absolutely fabulous for you guys to reach out for him. Even if it's a second opinion, I think it would be great. So as far as Joey's Legacy, for our listeners, if you could at all, just even $5, we say it, is donate so that we can get this documentary made. With this documentary, we can change some laws, get our pets to be seen as companions, not just property. So we need the donations. It's absolute must that this documentary gets made. We've already done some work on it, and we don't have JL Rob here tonight. He's usually the one that can tell us where we are. But the last I checked, we were at about $40,000 of the $100,000 that we need in order to get this made. So I have given lots of things that you can do to donate that won't really cost you anything. You can go on Amazon and join Smile, and every time you purchase anything, actual money goes into Joey's Legacy, which is a 501c, so it's tax deductible as well. So you can also go on Joey's Legacy's Facebook page, their website, and contact them in order to do any kind of donations. All right, guys, I hope that you'll share this. And Jeremy and Dr. Dim, thank you again so much for being here, and have a wonderful, lovely evening.
Thank you,
too,
Gary.
Take
Thanks
care,
for having
Jeremy.
See you guys
me.
soon.
Take care.
Bye-bye.